Hello everyone, Luke Smith here. This Saturday the 28th of October 2023, 18 past 10 in the PM, and I want to talk about someone that I recently just found out about for the past couple of weeks. This is not his YouTube channel, this is a channel that basically documents him. His name is Andrew Dick, and he is a lolcow, and he's one of those people which it's a bit difficult to explain, so I'm going to bring up the actual disease that he supposedly has. But the thing is, he's pretending that he's autistic just to get I'm guessing money and free housing out of it, which nothing in life comes for free. He's American, obviously, like most lolcows are, and he's basically tried to kill off his mother and father. His mother has one of them like respirators. She has trouble breathing, and his father is getting on a bit OAP, and so far Andy is basically I don't know if it's accidental or on purpose. That's the thing. I haven't really seen the actual report on it, but tried to kill his mother by using I think bath salts in the coffee machine, which yeah, yikes. And also he was using, I think, a diffuser, which obviously if you have breathing problems it's not going to be good for you. And he doesn't help his mother when she falls over. He just looks at her and films her saying, "Oh, why you do that? Why you fall off the toilet?" That sort of thing. And yeah, not a very nice man. Like I said, he is actually faking a illness, which this is it, and I can't pronounce it, so I'll just do this. Munchausen's. If we go to the I've already been on this site, the NHS site for the Munchausen's syndrome. This will explain a little bit more on his disease. Bearing in mind, yes, he has got arrested. The only problem is, right, he says that he wants help from the state. The only problem is that the state will not help him. He does not have like a legitimate disease which makes him vulnerable. He's just making up that he's got autism to basically seek attention. He's an attention seeker, in other words. So, Munchausen's syndrome, I'll see if I can read all of this, by the way, is a psychological condition, see, it's all in the mind, where someone pretends to be ill or deliberately produces symptoms of an illness themselves. In other words, being near people who has like a cold or the flu, that sort of thing. The main intention is to assume the sick role so that people care for them and they are at the centre of attention. So even the NHS recognises this itself as a syndrome. This is not a disease, this is like a syndrome. Any practical benefit in pretending to be sick, for example claiming incapability benefit, is not the reason for their behaviour. Oh, well, to be fair, I'm pretty sure it's the reason for Andy's behaviour. Munchausen syndrome is named after the German aristocrat Baron Munchausen, who became famous for telling wild, unbelievable tales about his exploits. Types of behaviour. People with Munchausen syndrome can behave in a number of different ways, including pretending to have psychological symptoms, for example claiming to hear voices or claiming to see things that are not really there. So far, like, obviously I'm not going to show his videos. Sometimes they're a little bit violent, because like they do have, like, he does have a video up where he bangs his head on the wall to gain sympathy, and obviously if I play it I might get a strike on my channel for like violence or something like that. But I don't think he actually hears voices. However, he does have like he likes to wear earmuffs and like sensory toys like real autistic children have. But for him, it's just a waste of money because he's not fucking autistic. He's just pretending to have physical problems. For example, claiming to have chest pains or stomach ache. Well, he is on the large side, so yeah. Actively trying to get ill, such as deliberately infecting a wound by rubbing dirt into it. I mean, yeah, he's pretending that he's autistic. That's an illness in itself. Some people with Munchausen syndrome may spend years travelling from hospital to hospital, faking a wide range of illnesses. When it's discovered they are lying, they may suddenly leave the hospital and move to another area. In other words, they're wasting police time, and they should be arrested for that sort of thing. Well, wasting hospital time, you know what I'm trying to mean. They do waste police time as well if they get them involved in something that is not serious. People with Munchausen syndrome can be very manipulative, and in most serious cases may undergo painful and sometimes life-threatening surgery, even though they know it's unnecessary. Well, to be fair, Andy Dick is a bit manipulative anyway. So yeah. What is the causes of Munchausen syndrome? It is a complex and poorly misunderstood. In others, is all in the mind. Many people refuse psychiatric treatment or psychological profiting, and it is unclear why people with the syndrome behave in the way they do. Well, to be fair, like, I think Dick just wanted basically be in his own house. At the end of the day, his parents wanted to kick him out, but yeah, I mean, I don't know if it's the other way around or not, but I'm pretty sure like his parents didn't even fucking like him because he's a violent man. Several factors has been identified as the possible causes of Munchausen syndrome. These include emotional trauma or illness during childhood. This often resulted in extensive medical attention. Personality disorder, a mental health condition that causes patterns of abnormal thinking and behaviour, which I'm pretty sure that's Andy Dick's problem. And a grudge against authority figures or healthcare professionals. That is definitely Andy's problem right there. Childhood trauma. Munchausen syndrome may be caused by parental neglect and abandonment or other childhood trauma. Well, to be fair, he wasn't really abandoned because he's living with his parents. So I'm not quite sure what it could be. As a result of this trauma, a person may have unresolved issues with their parents that cause them to fake illness. They may do this because they have a compulsion to punish themselves by making themselves ill because they feel unworthy, like when Andy banged his head against the wall and started crying uncontrollably. Need to feel important and be in the centre of attention. Yes, that is definitely him. Need to pass the responsibility for their well-being and care onto other people. That is definitely him. There's also some evidence to suggest people who have had extensive medical procedures or received prolonged medical attention during childhood or their teenage years are more likely to develop Munchausen syndrome when they get older. I'm bloody glad that I've only had like technically two surgeries in my life, and that was when I was a toddler, and another one when I was about, to be fair, a toddler as well. To be fair, I was very young when it happened. One was a collarbone one as well. It's like they can't. You don't really need surgery for that. They just put you in a sling and tell you to fuck off. Where was I? Here we are. This may be because they associate their childhood memories with a sense of being cared for. As they get older, they try to obtain the same feelings of reassurance by pretending to be ill. That's the thing, is like, yeah, you'd like to be looked after. Everyone wants to like get attention and be cared for and be fussed over. The only problem is you grow up, you get older, you learn to fly the nest. You can't be with your parents anymore because they basically said you're 18, get a job, fuck off, or pay rent. That sort of thing. I mean, I have to pay rent, and I do not mind paying rent, because it is the way. I pay my way, and I eat as well. I'm fully independent, so I believe Andrew Dick should be independent as well. There are videos out there of him reviewing something, and it's completely normal. I mean, you do not get autism overnight. You get autism as a birth defect, in other words. So explain that. Personality disorders. Different personality disorders thought to be linked with Munchausen syndrome include antisocial personality disorder, where a person may take pleasure in manipulating and deceiving doctors, like Andy does, giving them a sense of power and control. Borderline personality disorder, where a person struggles to control their feelings and often swings between positive and negative views of others. Well, to be fair, he hates his mother, tried to kill her, so yep, negative view right there. Narcissistic personality disorder, oh god, yeah, that's him, that's definitely him. Where a person often swings between seeing themselves as special and fearing they're worthless. It could be that the person has an unstable sense of their own identity and also has difficulty forming meaningful relationships with others. Playing the sick role allows them to adopt an identity that brings support and acceptance from others with it. Admission to hospital also gives the person a clearly defined place on the social network. Diagnosing Munchausen syndrome. Diagnosing Munchausen syndrome can be very challenging for medical professionals. People with the syndrome are often very convincing and skilled at manipulating and exploiting doctors. That's the thing, is like some of these medical conditions, like special mental health problems, they are very difficult to understand. Hell, like autism is an incredibly difficult one to understand. There are doctors still trying to understand why it happens. Even I don't understand it, and I'm autistic, so yeah. Investigating claims. If a healthcare professional suspects a person may have Munchausen syndrome, they'll look at a person's health records to check for any inconsistencies between their claimed and actual medical history. Healthcare professionals can also run tests to check for evidence of self-inflicted illnesses or tampering with clinical tests. For example, the person's blood can be checked for traces of medicine they should not be taking, but which could explain their symptoms. Doctors will also want to rule out the other possible motivations for their behaviour, such as faking illnesses for financial gain or because they want to access strong painkillers. Munchausen syndrome can usually be diagnosed if there is clear evidence of fabricating or inducing symptoms. The person's prime motivation is to be seen as sick. There's no other likely reason or explanation for their behaviour. Treating Munchausen syndrome. Treating Munchausen's can be very difficult because most people with it refuse to admit they have a problem and refuse to cooperate with their treatment plans. Some experts recommended that healthcare professionals should adopt a gentle, non-confrontational approach, suggesting the person may benefit from a referral to a psychiatrist. Others argue that a person with Munchausen syndrome should be confronted directly and asked why they lied and whenever they have stress and anxiety. Well, to be fair, that's my kind of approach. You gotta be like full on with these sort of things if that's the case. People who have Munchausen syndrome have a genuine mental health condition, so this recognises this as a condition, but will often only admit to having a physical illness. If a person admits to their behaviour, they can be referred to a psychiatrist for further treatment. If they do not admit to lying, most experts agree the doctor in charge of their care should minimise medical contact with them. This is because the doctor-patient relationship is based on trust, and if there's evidence the patient can no longer be trusted, the doctor is unable to continue treating them. Yep, that is true. That's things like with doctors, well, back in the day when you can actually get an appointment, it was all trustworthy. You can tell them everything and everything will be confidential. It's basically like a psychiatrist. Psychiatric treatment and CBT. It may be possible to help control the symptoms of Munchausen syndrome if the person admits that they have the problem and cooperates with the treatment. There is no standard treatment for Munchausen syndrome, but a combination of psychosis, psychoanalysis, there we are, and cognitive behavioural therapy (CBT) is shown to have some success at controlling symptoms. Psychoanalysis is a type of psychotherapy that attempts to uncover and resolve unconscious beliefs and motivations. CBT helps a person identify unhappy and unrealistic beliefs and behavioural patterns. A specially trained therapist teaches the person ways of replacing unrealistic beliefs with a more realistic and balanced ones. Family therapy. People with Munchausen syndrome still in close contact with their family may also benefit from having family therapy, something that Andy never wanted to do, or never did. The person with the syndrome and their close family members discuss how it's affected the family and the positive changes that can be made. It can also teach family members how to avoid reinforcing the person's abnormal behaviour. For example, this could involve recognising when a person is playing the sick role, or the sick card as I like to call it, and avoiding showing them the concern or offering support. Who's affected by Munchausen syndrome? There appear to be two separate groups of people affected by Munchausen syndrome. They are women who are 20 to 40 years of age, often with a background in healthcare. Unmarried white men who are 30 to 50 years of age. There we go, Andy Dick. Or Dick. Andy Dick. Is he still around? I think he got arrested, didn't he? It is unclear why these two groups tend to be affected by Munchausen syndrome. Some experts believe Munchausen syndrome is underdiagnosed because many people succeed in deceiving medical staff. It's also possible cases can be overdiagnosed, as the same person could use different identities. Fabricated or induced illnesses. Fabricated or induced illnesses, which used to be known as Munchausen syndrome by proxy, is a related condition. This is where a person fakes or induces illness in a person under their care, such as their child. Well, to be fair, I think Dick did it by himself, so it had nothing to do with his family. And there's a video for it. There you go. And yeah, this was updated last year in September due to a review in 2025. So yes, that was the video on Andrew Dick. Yeah, I know I couldn't play any videos, but some of these are a bit wild, so I don't really want to play them. If you want to learn about him, by all means type type in Andy Dick in YouTube, and you'll see this channel where I'm on now, and other videos relating to him, including the one I definitely can't show, which involves bashing his head against the wall and crying like a little baby. He also likes to wear diapers all the time, play with baby toys. It's like, that's not normal unless you have a serious condition, which he does not. So I hope you found this video informative. Yeah, unfortunately I tried to look for any of the Dramatical article or any article, like drama article about him. But yeah, there is nothing, so this is what I had to go off of. So tomorrow, Comic-Con, I will be there until about 4 o'clock, something like that. I'm not quite sure yet. But I want to get a few hours in, do everything there. Tomorrow's video will be a vlog about something that happened this week, and we'll be going over next week's videos in the time being. So I hope you enjoyed this video, and don't forget to like and subscribe, and there's all my socials up there if you want to support the channel. See you guys next time.